All right, let's switch gears now and talk about an issue that unfortunately has a real impact in our community. Children affected by gun violence. Here to talk with us more about that and shed some light on this issue is Dr. Derek Kelly. He's pediatric orthopedic surgeon with Campbell Clinic. Dr. Kelly, good morning to you. Tell me unfortunately, how prevalent this is, pediatric gun violence. Good morning.
Well, good morning. Yeah, thanks for getting with us this morning to talk about this. For the third year in a row, the CDC has released their stats on pediatric gun violence, and it's the third year in a row it's the number one killer of children in the United States, even above cancer and car accidents. We're certainly seeing that trend in the Mid-South. We're on track for this to be the highest number of pediatric gunshots that we've seen in the last decade in 2023.
That is awful. I mean, it's so disappointing and depressing to hear that. Locally, how does that play out? I mean, Memphis certainly is unfortunately a place that sees a lot of gun violence and unfortunately an increasing amount of children who are victims of gunshots, right?
Yes, of course. And I talk to colleagues all around the country. I'm involved in a number of research groups that are looking at this on a national level. And although it is prevalent in Memphis, we are not alone in this. This is a nationwide problem.
Okay, let's talk a little bit about some of the issues associated with it. And the one area I want to start with is both the physical injuries and then we can go into the mental injuries as well, the mental toll. First off, what type of physical injuries do you typically see in children who've unfortunately been shot?
Well, it is very unfortunate because we see all types of injuries here. Now, I'm a pediatric orthopedic surgeon, so I deal with spines and bones and joints. So a lot of the injuries that I take care are fractures of the bones that are struck by bullets or spine injuries. But my colleagues here take care of head injuries, brain injuries, chest and abdomen injuries. We see a large enough volume here that we're actually studying these injuries based on the region of the body that are harmed to see if there are certain regions that are injured more oftenly. For example, suicide injuries tend to be head injuries, accidents tend to be hands and feet, but we see it all over the body and in all ages.
Dr. Kelly, thanks for all that you do to help our kids in the community recover from such awful injuries. Tell me about the emotional toll, the mental injuries that you see from your vantage point.
Yeah, we're seeing this even more and more as our numbers rise, and we've actually instituted programs here to address this from the time the children hit the emergency room. We have our psychologists and psychiatrists working with them. We follow them through their recovery period. What we really don't know is the long-term implications psychologically to these children and families. We're hoping to learn about that in time, but those studies are still ongoing. It has to be a long-term effect. We just don't know to what degree.
Dr. Kelly, we have thousands of people that watch us here on the Action News 5 digital desk each and every morning. What would you like them to know about this issue of gun violence affecting children that you haven't stated really at this point?
Well, this is certainly a multifactorial issue. We're looking closely at our stats related to the type of weapon involved and the mechanism of injury, whether it be a suicide attempt or an accident or an assault. And what we've learned in the last decade, our numbers for handgun injuries, accidents, and assaults are really rising more rapidly than some of the others. So probably the best thing that families can do if they have a gun at home is to leave the gun safely stored and locked. If a child is in the home and has access to an unsecured gun, their risk goes way up for an accidental injury or for that gun to be used as an assault. And certainly this problem is not going to get better anytime soon. And you're certainly not protected from this if you live in a small town community outside of the big city. We're seeing kids come in from the entire region with these types of injuries.
A great piece of advice there. Always lock up any kind of weapon, a gun, if there is one at home. Anything else you'd like to mention before we let you go?
I just want people to be aware of this. I want them to educate themselves, think about this as they go out throughout their daily lives, think about this as they want to influence policy change, speak with representatives and policymakers about ways that we can lower these injuries for these kids.
I want to ask you, Dr. Kelly. I mean, it's got to be heartbreaking, and certainly there's an emotional toll when it comes to you and your staff having to deal with these tiny young kids that are affected by gun violence.
These injuries just they don't have to happen, and I would much prefer to go through my day without having to deal with kids who were shot needlessly. These are challenging injuries. Now, unfortunately, we see a lot of this, but that does allow the team to be very well prepared to take care of these. Our team handles this in a very professional manner. But at the end of the day, when you're sitting at home thinking about these kids, you just know that this is senseless and it needs to stop.
Dr. Derek Kelly with Campbell Clinic, orthopedic surgeon, pediatric orthopedic surgeon, thank you, and please pass along our thanks and appreciation to all of your staff that's helping address this very important issue. We appreciate you coming on the digital desk this morning.
Yes, sir. Thank you so much.